We finally got some good news for Obamacare. It's been sort of a rough road to travel, but it looks like the healthcare website has finally hit and gone past the 1 million enrollment mark. The victory came after a December surge that is responsible for 1 million of the over 1.1 million current enrollees, Zach. This is a promising sign for healthcare.gov, right?
Yes, it's great. I mean, I was talking to my uncle at Christmas, and he was mocking the website for only having 100,000 people enrolled, saying, there's 30 million people who need insurance. You only got 100,000, and so now it's up to 1.1 million thanks to the last week and some better functionality from the website. Although it's not all good news. They were hoping to have over 3 million at this point, and of course, it's not obvious the people who have actually signed up aren't going to have problems down the road because of other.
Do they actually have insurance, Zach, or did they just sign up? I mean, because there's the thing where you sign up on the site, and then there's the thing where the sign up goes to an actual insurance provider. Are we sure that the 1.1, which, as you said, is 2 million short of what we want it to be, are we sure though that 1.1 million is going to the right place?
We are going to know in a couple of weeks. I think that has been an issue that the Obama administration has been working on for a couple of weeks, that insurance companies have been working on, but it's actually one of the most difficult to solve because instead of just having a horrible thicket of government contractors and bureaucratic agencies that have got things confused, you also have a thicket of insurance companies that are involved as well. They technically have signed up. Whether they show up at the doctor's office in a month with a sprained hamstring or something and find out they haven't have a new fight on their hands with an insurance company, we'll just have to wait and see.
Zach, somebody wrote in from to the HuffPost community, and they raised a great question. Kringle writes in and says, what percentage of 314 million people is required for meaningful Obamacare, quote, success?
Well, I mean, we know that, for instance, they were hoping to get about 30 million people insured through this process. Eventually, when you're talking about 1.1 million going in through the website, that doesn't include all of the people who are included through the Medicaid expansion. There's basically two different expansions of the health insurance system under Obamacare. There's a Medicaid expansion, which says people who make a certain amount of money are now guaranteed government health insurance, which it was a significant boost, although the Supreme Court dealt that a really serious blow when it said that governors could just opt out, and a lot of governors just did. So now we have this weird situation where a lot of other people qualify for subsidies if they sign up for health insurance through this exchange. But if you're actually even poorer and happen to live in like Louisiana or something, you don't qualify for subsidies and you don't get any help. But I think 30 million is still not a crazy number long term. I think a lot of those governors will have to decide they eventually actually want to have this health insurance available for their citizens. Where you get this year, I think it's hard to say.